can hear it sounding back. Yeah. Okay. I think it would be good if people could introduce themselves because there's some new faces in the room. And for those of you who don't know, I'm Hazel Simmons and I chair the Health and Wellbeing Board. And perhaps we'll go this way, Nikki.
Yep. Hello, everybody. So I'm Nikki Lane. I am the link director with the ICB for Luton, and I also am the chief primary care officer. Thanks.
Hello, everyone. My name is Mark Fowler. I'm currently the interim chief executive, but also in this capacity covering as a corporate director for population and wellbeing.
Hello, I'm Nicola Ainsworth, one of the joint acting directors of public health.
Hello, I'm Elizabeth Elliott. I'm the other joint acting director of public health.
Jill Britton, and I'm the director of adult social care.
Hello, I'm Richard Underwood, elected member and chair of the Health and Social Care Screening Review Group.
Hi, I'm Pat Latimer, CEO of Healthwatch Luton.
And I'm Phil Turner, I'm chair of Healthwatch Luton.
Good afternoon, Hannah Leask, Head of Commissioning Adult Social Care.
Turned it off. Welcome, everybody. And before we move on to the agenda proper, I think this might be your last Health and Wellbeing Board, Nikki?
I'm afraid so.
Yes. So I'd like to say a few words. Nikki's been with us, I can't remember how many years, Nikki. I've worked with you. 10, is it? And you took over a little while ago as the vice chair, but you've been really instrumental into the Health and Wellbeing Board and into health in general for Luton and further afield. So we'd like to wish you well. I believe you're retiring. Am I right? Yeah. Fantastic. Seems a good idea to me. So we wish you well anyway for the future, and thank you for all that you've done for us.
Thank you.
Okay, let's move on to apologies for absence. I think we've got a few tonight, haven't we?
Yes, Chair, we have. We've got apologies from Councillor Mahmood, Councillor Malik, Councillor Ambia, Felicity Cox, Faith Haslam, Diraj Chiba, Anita Cyan, Robin Porter, Faith, oh, I've got Faith Haslam, and Stephanie Simone. Thank you, Chair.
Okay, thank you very much. So we now move on. Can I sign the minutes of the 11th of February? It seems a while ago. If anybody's got any issues they wish to raise, please do. If not, I'll sign them as a true record. Thank you very much. Remind members about disclosures of business. And obviously, if any members has got disclosure or pecuniary interest, please announce that. We've not got any urgent business this evening, so I move straight on to the information items. And the first one is item 6, the Bedfordshire and Luton integrated report. I think it came out later than the other reports, so I hope you've all received it. Does anybody want to say anything on this at all? Yes.
I'll just say thank you to Elizabeth, because Elizabeth and Vicky Head at the board gave a really, really helpful public health perspective, and particularly the growth in the area. So the report is as it is, and we'll pick anything up accordingly.
Okay. Health and Wellbeing Board are asked to note the report. Are we okay with that? Thank you very much. And then we move on to item 7, which is the overview of Health Watch. And I believe you're doing a report. You're going to present this?
Yeah, it's just an overview of the work we've done in the past year, the engagement that we've done. So we've done a number of projects for the ICB over the past year, including one for the MSK project, which was a piece of work where we held focus groups across Luton, getting people who use the MSK services to feedback on what they would require for a new service. We had sort of 4 service areas. We were looking how services work together to provide us a holistic sort of care, how services communicate with the service user, health prevention and health education, and people's access to the services. We looked at different groups across different areas of Luton, and we did one online focus group taking that feedback. The findings were that people obviously wanted a person-centred approach, that they wanted more information, they wanted a service that was in their area, that they didn't have to travel a long way to get it. They wanted a preventative pathway. They wanted their GP to be more educated on what services were available, better communication and lots of different ways. They wanted to be able to self-refer to this, and they thought some visual sort of picture pathways or flow charts would enable them to identify, where they were going along that pathway. Some people wanted a paper-based, some people wanted electronic, and it was certainly identified that people wanted different things, and the way to communicate that should be identified on their care pathway. The second piece of work we've done is for the ICB is about translation and interpretation services, and that report has been released today. And we looked at a range of primary and secondary services, and we went out with questionnaires to these services and spoke to staff and patients and asked them what they required. We found that a lot of primary services didn't know there was a translation interpretation service that they could use. So things like opticians and pharmacists didn't know there were services out there that they could use. GPs and dentists, there was more knowledge of the services, and we actually went to Liverpool Road Dentists where we saw them using services while we were there. We did Luton and Dunstable Hospital, Bedfordshire Hospital, and thought maternity services offered really good translation services, lots of options there, and the diabetic clinic. And we went to ELF as well, who also offered a wide range of translation services. We've also done some interim view. So we've recently done interim view of mental health wards in Luton, and identified feedback from them, talking to staff and patients there. On some of the wards, we saw a wide range of activities and therapies going on, and patients fed back to us that them therapies were good. There seemed to be a good relationship on the wards between patients and staff. Meals, the residents thought were good, and they thought that things were good. We did identify a few problems on Crystal Ward when we were there, and we're working with ELF to overcome some of them problems. On the wards, most of the wards said that the staff were happy on the ward, that they felt the staff numbers were good. And on Crystal Ward, there were some issues with staffing that is being addressed, and they're got job adverts out and through the process. It was on Crystal Ward that there was the feeling that patients thought that they were being ignored or dismissed, and they weren't quite getting the therapy that they thought they were needing. They thought there was no activities going on. We've just finished a project, well, we're just in the process of finishing a project, which was for Luton Borough Council, on the English and Gypsies and Irish travellers at Stopsey Village. Following a measles outbreak last year, there was a load of feedback that travellers felt that they were being discriminated against. And so we went up and we got some feedback on that. And now we're working with the GPs and the PCN there to look at that. So some of the problems we felt was they felt that when they said what their address was, they were told there was no appointments for them. And other cases of not being able to get prescriptions or bloods being lost or things like that, which could be error anyway. But the life expectancy of English gypsies and Irish travellers is less than other ethnic groups in the area. And so we're working with the PCN to look at what we can do to gain trust and support them sort of services. So the GPs have agreed that 100% of staff should sort of have cultural confidence training. And Luton Irish Forum is facilitating that with an organisation. And we're working with the social prescribers and going up there and doing some work on gaining confidence. So we're doing some blood pressure checks and some just some interactions to support that. And they're looking at how to encourage them to get more screening. We've been doing some work for the ICB across the winter, promoting winter comms. So information about Pharmacy First, 111, range of services that are there, and also information just about staying healthy in winter, vaccinations and what to do as well as where to go. We've enjoyed this greatly. We've been out to many community groups over the winter across all of Luton, online information, warm spaces that are the council warm spaces and other community groups that offer that, churches and stuff like that. So it's been really good. And hopefully reducing waiting times, people using Pharmacy First rather than getting a GP appointment where that's appropriate, and reducing the number of admissions to hospital. So that's been really good. And that is what we've been doing. Yeah, thank you.
Thank you for the full report. Thank you. Are there any questions for anybody? No? Okay. Yes, Nikki.
So only that Pat attended, we have a primary care delivery group. And I just really want to pick up, so particularly some of that work on the translation, it really is quite powerful. And some of the discussion this morning is it's that ongoing, there's quite a change of staff. There always is front-facing practice staff. We've got 27 number of pharmacists, dentists. So it is that relentless, but we do need the eyes and ears of all of us. So, you know, if there's a particular practice that, you know, you identify, we've got the generic address. Again, I'll make sure I give it to yourself, so that, you know, we need to be the eyes and ears, because we hear some of what Pat, and in fact it was Sumitra from the team who's been facilitating it across BLMK. It's one of the big recommendations from their Denny review. And I just think it's important that we get that, you know, that feedback loop with it. And good to have highlighted some of the work within maternity, and it's about identifying what is it they're doing there, and, you know, how we cascade that through. And I think just the other part of your report is about mapping when you're doing things, and we can then collaborate. So when you're doing the surveys, it can be, you know, us working together. We do need our residents equally to make that contribution. And I know within the Health Overview Scrutiny meeting next week, we've got a report. So it isn't something that we can just do on our own. We do need counsellors and understand what the offer is.
Because we haven't got time to go through everything in life, I just sort of make a comment that we've also done quite a lot of work on mental health for Luton Borough Council on the strategy, the new Luton Town strategy on mental health, and we ran a number of focus groups for children and young people on mental health, because mental health is a major part of what's going on at the moment, and we enjoyed that as well with the young people. It's amazing how open and honest they were with us when people were saying, well, they won't talk to you, but they did. Believe me, they did. And that's all fed into the strategy for that, for young people, into Luton mental health.
Yeah, it's just a comment really rather than a question. I just thought it was really interesting. Pat and I were talking earlier this week about some of this work, and I think particularly that work with travellers and establishing that relationship gives us a real opportunity to do some more work there from the council's perspective. So we'd look forward to picking that up with you, Pat, in the near future.
We're going back and doing video clips with a couple of teenagers, because obviously the report is quite in depth. So we've pulled out some main points, and we're going to get the young people to do video clips and put them on WhatsApp and stuff with the feedback, which I think is, be quite interesting. Yeah.
I think really just to build on what Jill said about the work with the Gypsy Traveller community, it's a community we're working with across central Bedfordshire, so we're looking forward to continuing the conversation there as well, in terms of making those links, and just to have a number of services linking with the same person is so sensible with that community. So it's really useful to know.
Can I just add, Luton Irish Forum is very good for links with the traveller community across Bedfordshire. Yeah.
Job. They really do. Yeah. Well, thank you for the full report. Thank you very much. If there's no further questions, we're happy to agree. Thank you very much. We now move on to the area for discussion, and it's the integrated networking and family hubs. And I believe, did you say Marek is online?
No, it's online. And Adams.
And Adam's up the back. Okay. Oh, and Nikki's as well. Okay.
Thank you, Chair. Yeah, we've got a few people actually who are going to input on this one, if that's okay. So, Marek, if you could flip it to the slideshow. So my name is Adam Divney. I'm the Director of Citizen Engagement and Legal Services, and have been leading as SRO on this work stream. And I've got some colleagues I'd like to introduce as well. I'll go to my left first. Nikki.
Yeah, Nikki Middleton. I'm Head of Customer Service and Complaints here at the Council, working alongside Adam and others on the Neighbourhood Working project.
I've got Elizabeth who's also going to do a few slides.
Yeah, so I think everyone knows me, but I won't introduce myself again. But yes, I'm going to be working with a bit of a double act today.
And Marek's online. He won't be presenting, but might be taking a few of the questions. So I'll just bring Marek in very briefly to introduce himself.
Apologies, folks. I had to stop sharing to be able to introduce myself.
Yeah.
So hi,
Okay.
I'm Marek Lewelski,
Hi.
Head of Social Justice and Community Safety. I'll go back to the screen. Thank you.
Thanks, Marek. So I think we've probably got 15, 20 minutes, Chair, if that's okay. And I think probably be around half of that, hopefully less us speaking and talking at you. And then we're hoping to have a discussion about some of the progress and where we go next. So, so what I should say probably is this is quite a big programme of work, and we've tried to squeeze quite a lot into it, into just a few slides. So I'm hoping this will be the start of an engagement with this board, and we'll come back and talk more than just today. So a bit of an introductory session to where we are. So next slide, please, Marek. Okay, brilliant. No, just get my eyes in order now. So this is our neighbourhood working programme, and this is part of the wider transformation scheme the council's got and programme the council's got working at the moment. So you've probably heard a little bit about the transformation programme, so I won't go into super detail around that. But this is about how we deliver services and work with partners in a neighbourhood level to develop and deliver outcomes for residents, in an improved way, really, simple as that. So it's in its most simplest terms for me about how we deliver our 2040 ambitions at a neighbourhood level. So, and the starting point for this project and programme was really that we already deliver loads of positive activities, interventions, services, programmes at a neighbourhood level. But sadly, they're not always joined up. And the consequence of that is the residents don't always get the best outcomes. So, you know, that will resonate with people, I'm sure. The presentation's just vanished for a second, but I'm sure Marek's working to bring it back. So thanks, Marek. And so, you know, in effect, this is about how we work together to improve outcomes for residents at a local level. So, and there are 3 key work streams. And the first one is around what we're delivering, existing delivery, what we're looking to deliver in future in terms of services. And that is really in the lens of prevention-focused projects and people. It's about maximising our outcomes from our built assets, starting with our council assets. So we're talking about our sports facilities, our libraries, our community centres and things like that. And it's about our relationship with the voluntary community sector, which is really important. We know we commission lots of activity through the sector. We know we work with them well in parts, but we know we could be a lot more effective, again, in that area. So next slide, please, Marek. So lots of writing on this, and we won't go into super detail, but just give people a few moments to absorb it, because the 3 sort of main threads, if you like, here around project objectives is around improving our resident experience, how satisfied residents are, delivering improved outcomes for residents, our impacts, and how we demonstrate greater value for money, so our efficiency, our economy and our effectiveness. And again, as I've mentioned, this is really quite simply about how we work better together to use our collective resources, recognising they're diminishing in lots of different ways to improve outcomes for residents. So I'll just pause for a moment and let people just absorb a few of the points on there without going into details. But I guess one of the things that is worth mentioning is just that eradication of silo working, which we know does exist. We know it exists in the council. We know we must get much better at working together as an organisation. But if we can't get that right as a council, it's very difficult to work with our partners and for residents to make sense of it all, really. So next slide, please, Marek. So what have we been doing? So just some sort of headlines around what we've been working on, and I'll do a little bit from me, a bit from Nikki here as well. So one of the first things we did, and in a good old-fashioned council way, was to map all of the interventions and projects and activities that are happening at a neighbourhood level. So whether it's, you know, the things we're doing around the Fairness Task Force, social prescription, lots of different things that we're doing to try and identify where the synergies are, where the dependencies are, where the risks are, silos are, all of the things you'd expect really, and how they're governed as well, who's involved, so we could get a good sense of what's happening at a neighbourhood level. So we'll come back round to that in a moment. One of the other things we've been doing on a more practical level is around our community prevention programme, and Nick is going to talk a bit about some sessions we've been doing particularly around that.
Yeah, so the slide that you're looking at is just that we were looking to deliver 5 community-based prevention events. We've actually delivered 6, and we are operating them very, very much on a test and learn basis. So selecting different neighbourhoods from across the town, and then tailoring the kind of the events to those communities. And they've been very, very telling in terms of what we've learned. So in terms of, you know, sort of the success of those events, there's been really mixed outcomes. The first 2, because of the nature of how we focus these, the kind of outcomes really become more evidenced sort of in the weeks after the events themselves rather than purely on the date, so we can be more clear about what the earlier events have achieved. But we've delivered 6 now across Leagrave, Lewsey, Wigmore, Farley, Biscot and Northwell. And some of what we've found has been a surprise, some of it has been as we've expected. What's really come through really strong is that the communities are dissimilar, that sort of neighbourhoods are dissimilar, issues in different parts of the town look very different, and engaging with residents in those parts of the town need to be very varied. So we know that there's a real nuance to the work that we're delivering here, and we need to be very much tailored in terms of being successful. We've established that there's huge appetite amongst communities generally. The majority of the events were well attended by members of the public, with strong positive feedback as well from partners who were involved. As I've said, because of the time lapse in terms particularly around financial support, we can be clear about the outcomes for the earlier 2 events, which were in Leagrave and Lewsey. Between those 2 events, we saw just over 50 members of the public for some quite detailed conversations on a one-to-one level. Around about 40 of those went into putting in financial applications for support, around 25 of which were successful. So we're kind of demonstrating a level of, I suppose, a lack of awareness within the community for support that was already available, and those face-to-face events being an opportunity to really kind of ensure that community members have access to that, and then through word of mouth that can grow, which is a clear sort of key part of the neighbourhood model as well.
Brilliant, thanks, Nikki. So just some other points then, just on this first work stream, we're very much, again, people and projects, as I mentioned. So we've designed with our colleagues in Human Engine an outcomes framework, so we can try and track outcomes and track it in terms of from inception to conclusion, to understand, again, is it value for money? Are we achieving the right outcomes? Is it the sort of way we want to invest our money in initiatives going forward? And funding going forward. One of the things we've been looking at as well is around a multidisciplinary team. So very much bringing our colleagues in housing together, our colleagues in welfare together, children's, to understand if we can deliver in different ways that improve outcomes again for residents. So doing that in a community setting. And also we've been looking at how we deliver training to our staff and employees in neighbourhoods to make sure that's joined up again. So we're making every contact count when we're speaking to residents, when we're having those interactions. Next slide, please, Marek. So the built asset side, we've been focusing very much on our community centres. So our community centres are fantastic assets to the council, to the community, to our partners, but they do cost a lot of money to run, and we're conscious of that, so we've been looking at the sustainability of these buildings, how we can drive down costs, but how we can improve the range of activities that happen in those centres, how we market those activities, how we ensure that we've got the right levels of partnership work, and how we're meeting resident needs in different areas. We've been exploring some place-based work in particular areas such as Lucy and Stockwood Park, looking at the combination of assets we've got in that area to make sure, again, that we're joining up our offer to local people and we're maximising those assets. We've managed to persuade the council and some of our partners to put some money into our community centres to refurbish 2 of them at Bury Park and Lucy, and we've also levered in around £100,000 for some improvements at Chorley for a multi-use games area, and the old boys club we're looking to develop into a space for women and girls. And we've been doing lots of work with a really important partner, which is Active Luton, so on our leisure estate, to improve the relationship in terms of the financial relationship and the sustainability of that relationship, but also to ensure that relationship can continue in a way that's right for residents, for the borough. Next slide, please, Marek. So again, lots of words, apologies about that. So, but in terms of next steps, some of the things we're looking to do over the next sort of 3 to 6 months, Nikki's talked about some of the prevention sessions. So we're looking to expand those with a further 20 planned throughout the year. And we're tracking that using our outcomes framework, as we've described. And we're looking, as I said, again, about pulling a team together, a healthier, wealthier, multidisciplinary team to be located perhaps first in the council, in the town hall, in the library, and then moving out to neighbourhoods, but linked very much to family hubs. We're looking at finalising that agreement with Active Luton around how that relationship looks into the near future to ensure that's sustainable, as I mentioned. And we're looking at reviewing our libraries offer from sort of root to branch to ensure that that offer, again, is sustainable in the years to come, and that residents are getting the best deal there, that it's accessible, and it's the way that we all see it wanting to run, really. So next slide, Marek. Again, doing lots of work around community centres, so ensuring we drive down costs, we improve the offer to local people. And then I think one of the pieces of work we're just really getting started on is about our relationship with our voluntary sector. So we're recognising, I think, how we need to change as a council, how we need to improve outcomes, how we need to commission differently. We recognise there's no immediate infrastructure organisation in the town, and we've had an absence of that for a long time. So it's how we develop that going forward as well. But fundamentally, it's working with some of our closest partners to start off with to make sure we can set and shape that work going forward. Next step, please, Marek. And I'll pause on that moment, hand over to Elizabeth. Thank you.
Thank you very much. And for those of you that know me, it's very rare that I go through a whole meeting without mentioning the words family hubs. So thanks to Adam for letting me. So family hubs is really one of the key projects that we've aligned ourselves with the neighbourhood approach. For those of you who don't know, so we have a hub, spoke and outreach model, and it is absolutely aligned to the neighbourhoods. And as you can see there, it doesn't come out that well on the main presentation there, but we have 4 hubs at 2 hubs and 2 spokes at the moment, all in settings across the town based on need. So we're basing where we have the most deprivation, the most number of families, and we are about to open our 5th family hub in Central Library in the next 6 weeks or so, where we will have 5 in total. And if you can't see those little red circles, they are our outreach. So we have outreach across every part of the town. I think we almost reach into almost every ward, but we certainly have multiple presences across all the different neighbourhoods. And we are delivering a range of services, including parenting support, mental health support, support and healthy lifestyle. So we deliver vaccinations, we deliver dental pop-ups, as well as the wider supporting parents with children aged 0 to 5, but focusing on the 0 to 2s and the Start for Life offer. But we are in the process of expanding that offer and really working to the 0 to 19 or 25 if you have a child with special educational needs. And that is our kind of plan going forward. So our sites, as I say, they're based on the neighbourhood approach. They're focusing on that access. So as well as all our in-person hubs that I'm talking about today, we also have an app and a website as well. So for families who can't necessarily access our services, we've got other options. So we're really kind of covering all our bases. Next slide, please, Marek. And this is another piece of work that we're focusing on. We're working together with Marek's team and in public health to focus on work just in one particular neighbourhood. So I've said South Central, apologies, it's West Central. It's the West Central programme, and we are doing a work this week around hypertension and the Know Your Numbers. So we are working across with primary care, with pharmacies, with PCNs, but also within community centres and communities, faith-based, voluntary sector organisations to encourage people to get their blood pressure tested. But the key part, although this is a really important piece around health and well-being, we're also looking at modelling how this works, how this neighbourhood approach to services is working. So we've got this general campaign. We're getting a huge amount of people coming through. We've had 2 days so far. We've got 2 more days this week. It's been incredibly well received, incredibly popular. We've been in Berry Park the last 2 days, for the last 2 days, and then tomorrow and Thursday we are in Luton Town Football Club. So really working at a neighbourhood level. So as I say, this is our pilot, and we are evaluating it, and we can report back and look at other options and see how it works at a neighbourhood level. I'm going to hand back to Adam.
Thanks, Elizabeth. Next one, please, Marek. Really loads of words on here. Won't get into super detail, but it was just to recognise the crossover with the LINK project, the Luton Integrated Neighbourhood Collaborative, formerly known as Fuller Neighbourhoods. So I think that's probably well trodden and recognised in this forum, but that's very much around health and social care. I think the difference between the work, this particular project is, I think we're slightly broader in terms of focus, as I've described already. We won't talk about all the LINK projects because I think probably everyone knows about them in this forum already, and I'm not an expert unless someone else particularly wants to put their hand up and talk about it. But where it connects really well is around initiatives such as just described by Elizabeth, Know Your Numbers. The link between the social justice and public health teams really strong there. Things around the social prescription review, the full fuel poverty and warm spaces work, the training of health professionals and the asset-based community development, which has been really important, and our joint-based place-based working projects, of which there's quite a few across the town. So Biscot's one of them. People would have heard about that, I'm sure, but there's lots of different projects happening, particularly in Beach Hill, across Dallow, around Farley, Northwell, Copenhagen Close. So lots of hotspots of neighbourhood working that are really start to evolve really positively. I think it's probably fair to say with this whole project, it's still quite early stages, even though we've been working on it for about 8 months. It's a bit of a complex one that we're still trying to get our head round to an extent. And I think the next 6 to 9 months is going to be particularly important as we bring our partners in and we look to develop it further. So next slide, please, Marek. So, and I appreciate you've had lots and lots of information thrown at you there, and I appreciate some of it's perhaps a bit more clearer in terms of where it's progressed and some of it's evolving as I've described. But we've got a few questions that we'd just like to raise, if that's okay, Chair. So these are three up there, you can see. So in terms of neighbourhood working, does this programme align with your areas of work and focus? So does it resonate? You know, is it something that you can understand and grasp and can you suggest further ways of integration and collaboration? So are there ways we can bring together some of the work, including your own work, and how or do you want to be involved going forward? So they're really the three questions, and I appreciate we can probably take them all in one hit, but it's up to you, Chair. Thank you.
Thank you very much for the presentation. We've got three questions to answer, and obviously there's an opportunity to ask questions of the team that are here and as well tonight. So who wants to go first? No questions. Yeah, Jill?
So firstly, thank you, everyone around the whole chamber for the presentation and the update on that work. I think for me, it's kind of like this is really important as a kind of a springboard of the kind of more systematic work that we need to do in this area to promote really a range of I suppose health inequalities work that we could be doing in this space. And I think the focus, particularly in the council design work, has been largely on maximising income and thinking in that space. But I think there is real challenge for all of us to be thinking about the wider health inequalities. So how do we drive employment in that space? How do we drive well-being in that space? And think about all of the things that would affect the individuals and cause crisis, either financial or personal crisis for those individuals that can escalate needs. Social isolation is another one, of course. So I'm really happy that I think I've been part of seconded into this group going forward to try and keep on developing the work and strengthening it. And I think we also need to think about how that link work in the fuller neighbourhoods connects. It's a bit of a Venn diagram in that space, I think, and there's some elements that are really to be driven, you know, through the statutory services and where they work in neighbourhoods to meet people with ongoing need and support, that we might need other partners to help support those as wraparound services, but also to think in that prevention element. So there's two sides to that, I think. I think my question really is just looking at your objectives at the beginning. They're very us focused, they're very council, break down silos. I've not met a resident yet who said what I really want is break down silos. So I think we need to maybe have a look at that, work with our communities and ask them what they would like to achieve and get those outcomes to be much more resident focused. That would be my recommendation.
Fair comment you've made there. And can I just say, I visited Berry Park today at the family hub. It was buzzing. It was really buzzing. Really, really good. Well done. Yeah, I hope the next couple of days go well as well. Okay, anybody else? Yes, Bev.
A couple of points really. We are increasingly involved with Link in the fire and rescue service in some of the work we do with our home fire safety visits, being an asset for health. Oh, sorry, yeah. No, can you hear me better now? We get into, I think it was 2,307 homes across Luton last year, range of sort of home sort of settings, but particularly round about 300-400 homes where there are children under the age of 5. So a conversation for us, perhaps, Elizabeth, outside of this in terms of the family hubs work.
Definitely. Is this not the Safe at Home project?
It is part of the Safe at Home project.
Safe at Home is a family hub project.
Yeah, great. So, yeah. But we've got equally, I think, an additional 200 homes that we've got into around that.
Lovely.
So, I mean, for colleagues in the room, we work in partnership with Safe at Home. They part fund one of our home fire safety advisors. But I think as well, we are quite agile in this area, certainly across the range of Luton's residents, and can respond quite quickly. And equally, when we're in the home, God, everybody loves somebody in the fire service sort of setting, don't they? you know, we open up discussions and then can respond and refer on. So again, we're very open to having those conversations to make sure we're talking to the right people and offering our sort of help in making sure Luton's residents get the most out of joining up, really.
Yeah, and happy to pick that up around the joining up, because if it is the same project, then it does make sense that even the same projects are completely linked up. Definitely. Thank you.
Okay.
Yeah, I think probably Hazel, and I think thanks for both the points there. And I think just going back to Jill's points, I think there's probably a little bit of a pause and reflect moment for us, actually. I mean, we've been focusing heavily around the prevention agenda, but you know, there's lots of other kind of spaces where this work leads into. You know, we talk about community cohesion, civic pride. There's lots of things we need to draw out. So I think we are having a bit of a moment of just bringing the right people in, taking a step back, making sure we've got our objectives right from the front end. But I think, you know, the next 6 months in particular, I think are going to be really important in terms of getting that right. And I think we would welcome certainly coming back to Health and Wellbeing Board as that work develops at a future date, because I think at the moment some of the elements still need some work to draw them together. You know, and I think we're honest about that, because it is quite complex when you're looking at it, a system-wide approach to neighbourhood working, if that makes sense. So, yeah.
And I was going to make, following on from the point Jill made about it being council worded, what relationship have we developed with the community on what we're trying to do here, the voluntary sector? I mean, do we work with them? Have they influenced what we're doing, or is that still to come? Because I think that won't change unless we bring other people in with other ideas.
I'll kick off, and I think Nikki might want to say a few words. Marek might even want to say a few words as well. But I think within the initiatives and projects that sit as the broader neighbourhood offer, there are, you know, lots of partners in that area. But there are some, particularly perhaps what have got a greater stake in it. You think about your sort of citizen advice, you know, particularly. We've been working with Mary Seacole in terms of development work as well. There are some partners who are really keen on developing this work and really proactive in the space. I think, as I sort of mentioned, one of the things that we haven't necessarily got what other places have got is that infrastructure set up in terms of the VCS. So sometimes it is slightly more fragmented, really strong partners in the sector. But I think it's how we choose to work with people and being inclusive in that approach as well. So, but I don't know, did you want to say a few words, Nikki, at all on that?
I think you've probably covered it all. I mean, I think as Adam sort of set out at the start, the kind of those three work streams are really key, and they are, whilst they're interrelated, they're also quite distinct in many ways. And the work with the community voluntary sector has been the least progressed of those three work streams to date. But as Adam said, like the next 6 months really are very much critical with it. And I think with anything along these lines, there's always that balance to be struck, isn't there, between really needing to be sure that you're quite certain of what you're looking at within yourself before you start going out and talking to others around those sort of that wider piece. So I think although it's been in some ways we're very much keen to get on with that third piece of work, it's been kind of necessary to take that sort of step back and spend a bit of time looking at ourselves really to understand some of the challenges that we have within the organisation itself before we start to kind of work with partners around how we address the broader system.
Mark?
Just building on what Adam and Nikki are saying, actually, certainly my own perspective on this is actually the third sector work at the moment, and the way we engage with the sector is disparate at the very least. And I don't think there is a coordinated approach of how we best do it. Myself and Adam were in a conversation yesterday, wasn't it? About how we can redress some of that stuff. That's absolutely the heart of where we want to go. The whole community engagement piece is very much part of where we're going, what we want to do and what we're developing. I think there's also a point here that we've got to really be honest with ourselves and hold the mirror up of how well do we genuinely work together? Where are those examples of how we're committing to doing that? Because as a senior leader in this organisation, I'm not convinced. And I think we've got to push through that and change that. And just by saying it's council and expressions and that, actually, what's the difference with delivering the other side? And that's really powerful. I think there's some wonderful stuff we're doing in family hubs. There's a conversation I was having with Bev earlier today as well about what we can do through trusted relationships. And actually teams of a real common goal. That's where this wants to go to, isn't it?
I think it can get there. I think, as Nikki's described, there was a bit of a getting our own house in order moment, and I think we've learned quite a lot over the last 8-9 months working on it, and that feels like a long time. But I think there have been some really positive deliverables in there as well. So I think we're comfortable with where we've got to, but I think. As Mark's described, we have to be honest with ourselves. There's a lot of work to still do, but I think if we take that approach and we're transparent with partners and we have the right discussions, we all recognise that we're better working together. There's no getting away from that, really. So, and I think we all recognise there's only a certain finite amount of resources we have between us, really. So unless we work together in the right way with a kind of common goal and setting of objectives, it gets very difficult, I think. So, but I think we've got some good heads around the table to try and crack that over the coming weeks and months. So I'm confident we can move that forward positively. So, and there are lots of different forums, like I say, that we haven't even got into here. The Fairness Task Force, lots of different other factors that segue into it. It's such a big project. It's almost quite hard to describe in a short slot, really. So, but yeah, as I say, I think the proof will be in the pudding certainly over the next sort of 3 to 6 months. And when we come back, if that's okay with you, Chair, I think you'll see the progress and you'll feel that next time round as well.
And can I just jump in? I know Jill's going to come in as well, but Nikki, this is beyond sort of savings and everything. This is about connection, engagement, the people we're reaching, the services are actually involved. Because some of the examples and what you've done are real testament to actually being different in that space. And when residents do think there is something to come to that's adding value to their life experience, reducing those isolation, whatever that context is, that is happening, isn't it? If you just share that.
And as I said, it would be great actually if we could speak at sort of more length around some of the outcomes. And my apologies, I don't know your name, Bev. But Bev's put the kind of the time with what you're saying around trust actually, and that's one of the biggest pieces of learning that we've seen. And somebody else, I think actually over in that kind, did you talk about earlier on? You were talking about people saying that people wouldn't talk to you, but actually then when people are given the opportunity, they can be really, really forthcoming around it. When I sort of said at the start that some of what we've learned has kind of tied in with what we'd expected, some of it really has rebutted some of the assumptions we'd made. So we've seen residents walk considerable distances across Luton to access events that are being held when we were told that people in the communities wouldn't do that. And they're very much doing that. We'd also, equally though, there were some assumptions we'd made about the support that people were already accessing because they were in supported accommodation or sheltered accommodation. And actually the levels of need that we saw in some of those venues was still much, much higher than we would have expected, because we'd made assumptions about actually how accessible people found that. And it still sort of requires people to take a step. So those kind of themes about really kind of being very kind of proactive about asking questions, being direct with residents, the community, and then kind of allowing them the space and the time to kind of open up has really kind of chimed. And as I said, it's about, as I said, the positive feedback, the soft feedback, soft outcomes around not just the relationship between residents and us as an organisation, but between our partners as well, and the opportunities for more collaboration, more joint working outside of those events is really where I think the value is going to come from. And as you say, we can only do so many things, but the kind of the ripple effect is where the value in this work is going to sit. And whilst Adam is absolutely right, we've spent a lot of time looking at what evidence we're capturing, what the outcomes we're looking at. I don't think we'll be able to fully measure the impact that we're having. And that constant and listening to what our residents are telling us and what our partners are telling us about what this looks like is really, I think, going to be the kind of the real driver going forward, even more so.
Thanks, Hazel. Yeah, I was going to say the same thing I actually wrote down about how we're working with the voluntary and community sector. I can think of loads of local organisations that would have really good feedback and input into this because they're working directly with our communities. Businesses too, I wonder, all organisations in general and the work that we're doing with communities and how we're integrating that into the people that work in Luton, because they're also, I wonder if that's a way that we can get better engagement, make sure we're going across everywhere. I had a couple of questions around how we're making sure that work isn't being duplicated. So some of the stuff around like the hypertension workshops that you're doing and things like that, is there any overlap in some of the work that the NHS is doing? How are we integrating that together? And more general about family hubs and accessibility and how they're accessible to people because a lot of the events that I see advertised are happening during working hours and families that can't attend because they're at work, and how that's happening over the weekend.
Elizabeth, did you want to pick up on those?
I mean, I think you've picked up. We've talked about this before, haven't we? Around having events outside of those hours, and absolutely, the reason that we have the digital access. I mean, you can access that app at 2 a.m. when your baby's crying and you don't know what to do. Do you know what I mean? We have that access really out of hours. Absolutely. I take your point that some of our events, or majority of our events, are during those hours, but we do have Saturday events. We do antenatal classes on a Saturday. We do dads groups on a Saturday, because aware of working hours and things. So we do some. I think some of these events like we've got on this week are absolutely in the school holidays, because we just need to work out it's when families are around and looking for something to do. So we're trying to cater it to the needs, but we do think we have a really flexible and an offer that meets people's needs at different times and different places. Does that answer that question?
On.
Oh, sorry. Yes. So the event that the hypertension event this week. Oh.
I mean, in general, how we're making sure that it's the stuff that we're doing is not being duplicated. We're not coming up with these programs to give to people that the NHS or the pharmacies or partners are already doing, and how that can be integrated.
Right, sorry, and we working really closely. I'm just looking to Nikki here, because I think Nikki can vouch for the way and we work, the way that we work with the NHS, with our PCNs. We have a place-based team, so part of the neighbourhood, part of the link work. So we have people based, the NHS have a team based in Luton who work to ensure that exactly that we work really closely across, so that we are working in tandem and flexibly as much as we can. So for example, even today, I know we're not only talking about that event, but that was PCNs were there, pharmacies were there. We absolutely integrate as much as we can.
Yeah, so just in terms of the link neighbourhoods where we talked about there, that health are key partners within that, alongside our voluntary sector and the council. In fact, there's probably more health representation in those than any other organisation, because obviously there's lots of health organisations. So although that the particular hypertension thing is delivered by public health, it's in partnership with the GPs and the other health professionals. So we're not duplicating, we're building on and working together to deliver things that are targeted to the specific needs of Luton residents.
Perfect. Yeah.
I was just going to also say that collaboratively, for example, social prescribing, we have a lot of those workers that are employed in different parts of the system, but we're working in that collaborative way. It doesn't, so as a resident, it wouldn't matter who employs your social prescribing. And equally, then there's that element of working across that bigger system, about sharing some of that good practice. So we know there's some really good ideas that have come from work in different parts of the country as well as BLMK. So again, that just gives that support, and that all comes back into that link work.
Jumping quickly. I just wanted to come at from a very, very different angle, which is the point that you touched on about businesses. So again, one of the findings from the test and learns that we've run around was it particularly strong in Farley Hill, and it was one of the poorer attended events. So we enabled us to spend some time actually engaging with local businesses in the area, just having conversations with them. And one of the really clear things is that there's an appetite amongst local businesses in the area to actually be a touch point, really. So we're now going to come back, reconsider what resources we can provide those local businesses with that will enable them to kind of signpost individuals, pick up when they're identifying some of the needs, some of the challenges that exists. Because it was really, really clear that that sense of community and some of those local businesses, I'm talking about shopkeepers essentially, really understanding actually who their customers are, what's going on for them. And actually, if we're able to equip them with some additional information, that will be another channel for people to kind of another touch point to access, and really does kind of emphasize that neighborhood in its broader sense.
Yeah, just wanted to come back on just kind of the reflections on Nikki, you highlighting how the feedback that you've got from residents has been really, palpable and unexpected in some ways through the work. And I think that's absolutely, to be honest, what I would have expected. And I think that's why we've got to have that co-production and not be afraid to go and speak to our residents and our VCS partners right at the beginning of projects, not when we've got our house in order. Just get out there and find out what they want, how they want to be responded to, the things that are challenging them, the things that they want resolved. And then it's time for us to reflect and see how we respond to that, and then talk about the options and develop those together. It's really difficult and challenging for big organisations to give over that power to the other people, but it's so vital. We will become more powerful by sharing that power with our residents, with our voluntary sector organisations and other businesses, community groups. That's how we get stronger. So I encourage you to do that, and we'll be there all the way, because sometimes those meetings can be tricky, but you know, they're really important ones. That's, if they're tricky, it's because we need to change.
Yeah, just a quick question. Do you have a co-production charter?
So in adult social care, we've just done a lot of co-production work. We haven't quite got as far as a charter, but we have got a framework, and we've just trained all of our adult social care professionals in co-production, and that is now rippling across the councils, and lots of work done in public health and other areas as well, but just answering from adult social care.
No, that's really interesting to know. Thank you.
Just one of my favourite comments, really. So I've been at Berry Park on the health checks for the last 2 days, and I think, if I remember, I haven't looked at the poster because I just get told we're going there, so I go. But I'm not sure if we don't communicate well enough at times, I don't think, on what the benefit is for people to do it. We say, come along and have a health check, but we don't say what the benefit is of having the health check. And I think if we were better at communicating what the benefit is to the individuals, you know, we know what we want as a system, and we know why, but they don't. And to communicate the benefit to people, I think we would get more uptake and more inclusiveness.
Something really quickly. I was thinking about this the other day around the health checks and stuff that we're doing. I think it's really, really good. I wonder if we go into places, like, for example, if you know that people are at a mosque on a Friday, and going in there and bringing the health check there, rather than expecting people to come to different places, because humans are lazy. So I wonder if that is another way to do things, get better engagement.
We actually do that. So yes, with one of our main outreach places for health checks is in the central mosque. So we have done that. We don't do it we're not there every week, but our provider does go specifically to the mosque, and we're doing a lot of work around that, and we're using health checks actually as our kind of leverage as well, because I think it's something that, I know what you're saying, Phil, but actually people really do want to get this information. They do want to access, they do want to know about their health. So it works really well. It's a real benefit and a real good partnership piece as well.
No, just really, that's loads of feedback there. Really, really helpful. I think they're sorry. I think Nick, I might have one comment quickly.
It was just to say, in answer to, can you suggest ways to improve further integration and collaboration? The Marmot work, health equity piece, if we can, make stronger connections there, that would be great.
And I think we are, and I think, you know, there's as you can tell from this conversation, it could be such a broad piece of work, and we're trying to make sense of that, and it's not always easy. I have to be honest. You know, there's lots of different systems of people and residents, and I think Jill's points really land with us in that we should be resident focused, talking to our residents, what they want, how we can improve their lives, quite frankly. You know, that should be the starting point. So I think we need to keep that very close to our approach going forward. But overall, I think, you know, really helpful session. Thanks for your levels of engagement. I think we're really excited about the next few months. I think this project now, we've done some interesting things over the last 6 months or so, but we're all, I think, primed to really kickstart it and move it forward at a bit quicker pace and in a slightly different way as well, and colleagues very much on board with that. So I think we'll keep feeding back to the board, if that's okay with you, Chair. And you know, I'd just say thanks again for your participation and comments. Thank you.
You're coming back and presenting later on when you're a bit more organised, yeah? That wasn't a criticism. That was just yeah, it's a fact. Fact. Yeah. Okay. Okay. Thank you, everybody. We now move on to the performance management items, residential and nursing care update, and that's Hannah. Yes, welcome.
Thank you very much. I have got a few slides I'm just going to bring up onto the screen, hopefully. Bear with me 1 second. Okay, brilliant. Hopefully everyone can see those. So thank you so much. My name's Hannah Leask. I am the Head of Adult Social Care Commissioning here at Luton. I'm here today to give everyone an update on the work that we've been doing to transform our nursing and residential care home markets here. So in terms of what we're covering today, this is going to be giving an update. I believe there was some work that was presented to the Health and Wellbeing Board in December last year. So that's just to kind of update on the work, a bit more of the data that we've got now and the work that we've been doing since then. We're then also going to be talking about how we're really moving forward now from having a really good look at the data we've got available, really understanding the as-is position, to moving forward now to actively looking to shape that market. Really thinking about how we can work collaboratively with providers, but also with partners and residents, crucially, to really think about how we can completely maximise the value for money, but also the quality of the services that we commission in these spaces. We're also hoping, if there's time, that we can have a little bit of a conversation as well within the room around how we can really work together as a system to achieve the aspirations that we have in this space. So some slides here which are in the report that you've received, but just really to update on the position here. In terms of demand, firstly on this first slide, we're seeing that kind of as expected in terms of population growth. We're seeing demand for long-term nursing and residential care steadily increasing. It's not kind of an exponential rise, it's broadly, we think, in line with population growth, but you can see on that blue line there that we are seeing a gradual and kind of steady increase in the number of people we have placed in long-term nursing and residential care within Luton. There has been some more stability in the use of long-term placements for our residents under 65. So that's the green line, which is a bit more of a plateau situation or a slight dip actually in the nursing space, in the residential space. But we are very clear that actually these numbers we've got here are really useful and helpful, but they don't always tell us the whole picture. They're just numbers at the moment, and obviously there's people that sit beneath them. And what we definitely are seeing that you won't see in these figures is a real increase in complexity in the needs and the support required for some of the residents within these placements. Won't go into lots of detail, you've got the information, but we are seeing a slight kind of reduction in the number of short-term placements. In terms of cost, that's on the next slide here. And again, this has been updated from the last position. What you can see again is that there is an incremental growth in the spend that we have put obviously in line with that population growth and the numbers increasing, but we have seen quite a sharp increase of around £3 million a year expenditure on placements for these residents. And what we're saying is that actually that is driven to a certain extent by the increase in numbers, but actually there's a big driver there in terms of the cost, in terms of the costs of the individual placements that we're commissioning. So that's really what we know is driving that increase. And a lot of the work that we're trying to do through this transformation programme is looking at how we can contain and better manage and get better value for some of our placements. I've done a quick slide here on quality. Again, not to go through this in too much detail, but at the moment, around 3/4 of the care homes that we commission within the borough are rated as CQC good. We have, however, seen some changes in the way that CQC are inspecting, and we are aware that there's a bit of volatility in the market. We're aware that there are some providers that we think are probably going to have their requires improvement ratings either continued, or there may be some who are going to be downgraded to RI. So we are working really closely with our providers through these changes in the CQC inspection regime, but also through our quality team to really work in partnership with them to help improve and drive up quality wherever possible. Another point on quality is that we're aware that a number of our homes in borough, that some of the physical quality of some of those is a bit limited. So the next bit here is kind of talking again about the as-is. There's big documents that sit beneath this with a lot more detail, but this is just kind of pulling out some of the main points. From a commissioning point of view, we completely spot purchase our care home placements. So we don't have any kind of formal commissioning approach there, a framework or kind of block bed arrangements or contracts in place. And we're going out on every individual placement, we're spot purchasing that, which can, as you can imagine, cause some delays in terms of sourcing. There's lots of kind of negotiation on a kind of case-by-case basis. And we're also seeing a significant proportion of our placements being made out of borough, which some of which is due to resident preference, but also often because we're not able to identify appropriate or value for money provision within Luton. So there are some gaps we're very aware of within the market. Another interesting point around cost is that we do have standard rates that we set for our care home placements for nursing and residential provision, and that we uplift on an annual basis in line with inflation, changes to the national living wage, etc. But what we're actually seeing is that around 80% of our placements currently are being made well above our standard rates. So I think what we're doing through this work is really understanding that, doing a lot of work with our partners called Wellbeing Care to understand a lot more about what is the actual cost of care for these providers, so that we can make sure that our rates are reflective of that, and again use that as a bit of a lever to better manage the market. We're aware that there has been some volatility in terms of some changes in the local market. So we have seen one of our larger care homes did close a couple of years ago. So we are seeing a reduction there in the amount of capacity in the market. But we are also constantly working with the market to scan in terms of if there's any providers who are looking to open, and working with them to try and shape and make sure that what they're developing will meet our local needs. All of this means that we're not really maximising the commissioning levers that we have to really drive cost, quality and market sufficiency as we'd like. So moving forward, what we're really clear here is that obviously we've got lots of cost and demand data, we've got lots of activity data, but really I think there's similarities to the previous item actually about, for this to be a really genuine transformation, we need to really think about the way that we engage with our provider market, and we need to think about the relationships that we have there, and wrapped around that as well, not just the relationship between the council and providers where we have that main kind of purchasing relationship often, but all of the kind of other community partners, VCS, health partners, that we're all very much joined up and kind of wrapped around those providers to give them the support that they need in often very kind of challenging times. So you've got a bit of a diagram here which kind of sets out the main strands of the work that we're doing, which I'll talk through in a little bit more detail. So I've talked about this, it's kind of strengthening provider relationships. We're really clear that this isn't just about us kind of issuing a whole load of new contracts to the providers. We need to really take them on the journey with us. We're very interested in co-producing with our providers as well as our residents. Providers, in my experience, often have answers to some of the kind of questions that we have and are able to support us to kind of come up with collaborative approaches. We are already taking steps to kind of just improve and standardise our communication with providers through various channels that I've listed there. And yeah, as I said, we're very committed to listening to our providers through this whole process. We're very aware that there's been a bit of a fragmented relationship there previously, and it's really important that we work with providers through this. And we've started that process already. Co-producing with residents, again, I've touched on this, but you know, it's absolutely critical that when we are going through this process, we will likely be developing new specifications for the services that we commission. And it's absolutely critical that residents' voices and views and aspirations are very much built into those specifications. So we are also planning lots of co-production with residents through that, as well as their friends, families and carers. One of the strands will be, as I've alluded to, kind of thinking about a new commissioning approach. So we're moving us away from that very kind of reactive spot purchasing approach to having a more formal commissioning arrangement. So that could be one of these options, which may be the development of some kind of framework. The block booking of beds so that we've got some more consistency and availability there, or the introduction of new fee banding structures to make sure that the fees we are paying are more reflective or very clearly reflective of the cost of care and more accepted essentially by our providers. We're very clear as well that we need to take quite a sub-regional view around this. So we have started having some really positive conversations with our colleagues across BLMK. Within care homes, unlike some of the other kind of care sectors, there is a huge amount of cross-borough placing. So we have a lot of people placed in our homes from neighbouring boroughs and vice versa. So actually having within this context a sub-regional approach to really thinking about the nuances and the relationships and movements between boroughs is really important. We're also aware that other neighbouring boroughs have very different commissioning approaches to us. So we're doing a lot of work there to learn, to understand and to actively explore opportunities for collaboration wherever possible. And the last one, quite an exciting one, is around opportunities to potentially build, acquire a new care home. So as people may be aware, we recently had a capital bid approved to do this piece of work, which does provide us with the opportunity to really increase our in-borough capacity, manage the market and develop a service that will address our areas of unmet need. So really shaping what that would look like. We are very clear that there will be some way in the future. There's some more work to do to make sure that we, you know, have the right opportunity, that we're very, very clear about the demand and how we'd want to use that. But it's really brilliant that we have that kind of lined up to play with. So that will also be something that we'll be exploring and feeding all of our detailed kind of cost and demand analysis into through the project. So I think I've kind of cantered through that a little bit, but it was really just to open up again for any kind of feedback, questions. I have put a few within the pack here, but obviously very happy to take any questions people might have. But some of the things we were really keen to understand from board members and from partners here today is, how can we work together as a health and social care system to deliver the transformation work listed above? As I said, recognising this isn't just about a kind of relationship often between the council and providers, but how can we wrap around all of those kind of necessary services? What role can other partners or should other partners be playing in this transformation work? Which health and community partners need to be involved in this work and how? So that's kind of leading on from that point. How can we ensure that the future services that we develop and commission meet the needs of our diverse population? And the last one that I'm personally quite passionate about is, how can we make sure that our care homes are better linked in with our other local partnerships and communities? I think quite often care homes are kind of seen as separate or kind of secret spaces that sit separate from the broader community. So how can we as a system be kind of changing that and reaching in or supporting residents to access elements of our community, even thinking about kind of family hub type library offers, whatever that might look like, to break down those barriers and improve wellbeing. So yeah, that was kind of my piece. Very happy to take any feedback or questions.
Thank you very much. Thank you very much for the report. Are there any questions from anybody? Umi.
Thank you for that report. That was really helpful. I really like the fact that we are looking to source a care home for ourselves, that the council can control. We can control costs. We can control the adequate the provision is. I think your last point there about how can we ensure that care homes are better linked to our local partnership and communities is a really, really difficult task to do when a lot of these are big national providers that are kind of leeches of money. I don't know how else to describe them. So it is difficult, and I don't actually know how we can do that. Have we ever thought of things around, so I know you said around the other boroughs in BLMK specifically and how we're the lowest cost, but getting into an agreement around standardisation of costs, so or even not just BLMK but across the region, that way these care providers won't have a monopoly and be able to pick and choose on where they want to go, that's going to give them the most money, and then that leaves other boroughs out of pocket.
Yes, absolutely. So on that last point, yes, that's definitely the types of things that we are starting to have conversations around. My experience from having done this in other places, so I was working in North East London until not too long ago, and I think we were having quite a lot of conversations about the principle of aligning our rates and aligning, you know, what we're paying to providers to try and have that more kind of joint up market management approach at a sub-regional level. And I think it's often it makes a lot of sense in principle, like the practicalities of actually getting to those standard rates can be more challenging, and I think it can take a huge amount of kind of commitment and work to kind of actually get those rates aligned. But I think even if we don't get to the point of having exactly, you know, standard rates across a sub-regional level, the fact we're having these conversations and sharing our information, sharing our intelligence, sharing our pressures. And it might be that, you know, we started having conversations about, even if it's not like standard rates that we'd be using, that is one of the options, just some principles, you know, around if we are, there's lots of requests coming through at the moment for one-to-one care and support for residents. So is there something about having a standardised approach about how and when we agree that across the sub-region? So I think there's different, back to your question, there's different levels of how we can do that, but that's certainly something strategically that we're trying to work through at the moment through the project.
And then just a couple of other things. So what are we doing in terms of empowering people to continue to be able to be supported at home, to take the strain off us? And where does the NHS come into this? So, I mean, like the ICB, because we know the bed blocking is costing so much to the NHS that it's in their benefit to be able to have care placements. And what is whether it's person contribution or input contribution or financial contribution to improving the primary sort of the social care access to then have because then there will be some sort of benefit to the NHS. I just want to know how involved they are in these conversations.
Yeah. So on the first point, in terms of home first model, so absolutely, I think we've got other pieces of work happening across adult social care and the council to make sure that we're doing everything that we can through the way that we commission. We're currently remodelling our reablement offer, for example, to refocus on getting people back to best and keeping them home, doing lots of work around extra care and other provisions, and also, you know, the support, the upstream support that we can give to make sure that people can be supported at home. That's still very much a you know, a policy direction for us. But this is, I suppose, about we recognise there always will be people who will require some kind of residential service for a number of reasons. So this is about the scope of this project, I suppose, is about making those placements the best they can be, the best quality they can be, and the best value that they can be as well. On the second point, I mean, there's colleagues from the NHS here. I don't know if any of you want to come in, but yeah, absolutely. I think that's something that we are part of the reason we're coming here tonight as well. We are obviously working closely with ICB colleagues in a number of spaces around the work we're doing on BCF and others. But yeah, I think we are having those conversations all the time. But I think there's definitely something about making sure we've got the right health colleagues on our project team that's meeting every 3 weeks now. I think we need to start accelerating that engagement specifically on this piece of work. I don't know did you want to come in, Jill?
Yeah.
Of course.
So they're really, really valid points, and it goes back to Adam's earlier our question about how we're working together. So there are some real basics that we've got in here, and you may have heard it during the COVID time. We had something called enhanced health in care homes. So now GP practices actually work with one care home, and they have an absolute, see it as a tripartite thing with the community provider, with the care home. So that a lot of it is trying to look at the prevention. I love the slides, Hannah, with regards to the exercises, because actually there's a lot of evidence. You get people active, it will reduce the falls, it will keep people well. So that's one part. Second part about working in, absolute in collaboration to the residents is how it's well-being. They're vulnerable people, and we know there's loneliness. So some of the PCNs, and it's been small, small pilots, but actually you start getting different parts of the community. We haven't done it in Luton, but certainly it's been done in other places with younger children, almost surrogate grandparents. So there's lots and lots of opportunities there. But I think the other point, really, it's about that strategic commissioning with Jill and with Hannah, in the sense that we're working as a system. When you've talked about some of that pricing, because we know that there are people with much higher needs, and it really is identifying the care homes that can actually meet that need. And sometimes that is that ongoing training. The other bit I was just going to say about working collaboratively with the NHS is that we have a pharmacy technician and a pharmacist working as part of your teams, and we also have care standards nurses. So I really do welcome. It was last month when we actually got together all the system leaders exactly on that bit. What resources have we got to support? And then my final thing, and Elizabeth and Robin have been attending the board meetings. There is a system strategic work about complex care, and you mentioned the word standardising, and absolutely that is it. So I know Jill, along with other directors of adult social care, that is part of the programme. So I can give you, there's a lot of work we're doing to try together, but it is all of us leaning in, and it's as much, we need the localism actually, and using that sort of, that centralised bit where it supports.
Yeah, if I can just come in and thank you for Nikki for that, because it's a really good example of the breadth of the work that we're doing with health in this space. But I guess, we want to take it further, and that's why the questions were posed. And I suppose it's a little bit disappointing today that our trust colleagues aren't here, because that's really who we were trying to talk to, is like, how can we build on the initiatives that we've already got, because we do have some great work, but we also know that there's some work happening in health that is also, has fantastic opportunities, such as our dementia intensive support service, but hasn't been working so well recently in Luton, and we want to drive up the quality of that and really get that value for money from there. So I think there is an opportunity for us to do more and to go further, because ultimately it's health colleagues skilling up to a large extent with us, the workforce within these homes. And it's perhaps not all of them, perhaps this is where the commissioning comes in, that if we could commission more strategically to focus our attention on some specific homes where we really want to drive up the standard of care to reach those very complex needs, because they're the ones that cross our threshold often. You will see in the pack that we're supporting less than 400 people in nursing or residential care. We have about 3,000 people supported in adult social care. So it's the tip of the iceberg, but they've got really, really complex, challenging conditions. That means they need 24-hour support. And we need our health colleagues to support those professionals working in the care homes to develop their clinical skills and to be able to support them and to spot early signs and work in collaboration, be able to call clinicians from different parts of the system, speech and language therapy or the pharmacist or whatever, in as and when it's needed to kind of support those individuals so they have the best quality of life and get the, the kind of high quality care that we want for all of our residents, and for them not to be afraid of taking on more complex cases. So that's the kind of work that we want to be doing with our health partners in this space. they also, you just mentioned funding there, Ormi, and obviously just to make it very clear that for certain individuals there are who have specific health needs, they are funded either in part or fully by our health colleagues, and we make sure that all of that runs smoothly as well through our joint commissioning arrangements.
Oh, no, no,
No, I don't think so.
no. Umi?
I think this is probably beyond this conversation in here, but with the government looking at social care and the reforms around that, how involved are we getting in the discussion? Because they're looking at things like care providers and putting a cap on how much they can charge. Are we involved in those discussions at all, or are they so far-fetched that it's probably never going to happen? Just want to know a bit more about that.
Yeah, well, it's very early days in what that care reform is. I think it's unlikely that they're going to be able to just put a cap. The costs of running care homes vary from care home to care home, based on a whole range of things, including what is the market value of the land that care home is on. So how big's your mortgage? What lending have you had to have, as well as the costs of the staff and the provisions and the type of decor you've got and the food that you serve. You know, there's a range of multiple factors. I don't, in all honesty, think that in the whole, care homes run away with the market with extortionate prices. It's not like the children's sector where we do see that happening. The profit margins are generally reasonably low. I think particularly the case in Luton, actually, because I think we're not provisioned by those large kind of hedge fund type organisations. That isn't what our local picture is. So there might be some cracking down on those things, but it would be difficult. They've found that challenging in children's where that is running rife. In terms of our involvement, so most of that work and that policy influencing is by the the Association of Directors of Adult Social Care, which I'm a member of, and so I would feed into those policy discussions as a member of that organisation. So that's where Luton Voice will be found.
Just a quick question in the context of the changes in the ICB, the staffing numbers, that kind of, is that something we need to be aware of, minded with regards to risk, future change work, strategy thinking, that kind of thing? And equally, I mean, we're not in a position to answer what the future looks like, but it's certainly something for us to note at the board today, and also sort of on the forward plan with regards to risks and things. But just in this context is where I'm asking the question.
Yeah, I mean, I think within this context, it's difficult to tell. I don't think these are the things that have been particularly targeted in those change mechanisms. But of course, anything like this is a risk because we don't know at what point, how deep those savings or where they will go. And they're talking about management, but then management's a big word, and it can be a bit of a catch-all, can't it? So who knows what that will mean? So it is definitely a risk. I think we're unclear at this point as to what specifically those risks will be and how we can mitigate them. I guess there's also an opportunity, because if there are work that the ICB is currently contributing to or wants to in different ways, then maybe there are things that we can take on as shared services and support them in that, in terms of reducing their management overheads. So there may well be opportunities as well for the council and the adult social care within that space. In fact, I was just speaking to someone in the ICB about such an opportunity just before this meeting. Nothing concrete yet, but certainly looking at where they can see a gap in provision and wanting to do more strategic work, but feel that it may be safer for the council to do that in partnership with them, to protect those funds and those and still drive those opportunities in the face of those significant cuts that they've got.
Come back in, Anna, on anything? No.
I don't think so, no. I
No,
think that was
no.
really helpful. Thank you for everyone's feedback.
I don't think we've answered all your questions, but I hope it's given you some feedback. Yeah. Yeah. Okay. Any other comments from anybody else? Happy to note and thank Hannah for the presentation. Yeah. Thank you very much. We now move on to the items for approval. And the first one is the Better Care Funding Q3. Who's moving that one? Yeah.
Do you have a couple of slides? I'd just like to quickly run through if we've got time, Chair. Thank you. So first of all, I would like to start by apologising to people for the fact that this is once again retrospective approval of the Better Care Fund. Just come up on the slides. So there are actually 4 documents that have been circulated today. The first is the Q3 24-25 reporting plan. That is very, very high level this year because there has been a change in the Better Care Fund team, and we now have new members, and it has been kept to a financial document. So just basically setting out where we are in our spend, and a quick update on the metrics which are on track for 24-25. There has been a bit of a change around this year. Normally we'd be presenting the plan for 25-26 in June. Because of the new government, this has been moved forward, and it's been moved forward ahead of the end of year planning, which has been a little bit of a shock to us all because we haven't even got to that stage yet. So you have seen in your pack, you'll have seen the 25-26 narrative plan, which is quite a heavy plan. Once again, a lot of our investments are into core services, joint contracts and joint roles, with a small percentage going into change projects. Those change projects remain the same as last year with the one new additional project. So those of you may recall that last year we had the full SPA and the therapy model that continues into 25-26. We also have the Healthy Aging Programme, which is a preventative exercise programme, and the Enhanced Health and Care Home programmes, which Nikki mentioned earlier, which continues into 25-26. The new change scheme for this year is actually Digital in Adult Social Care. This is a programme team that we are funding across BLMK, where Luton has a quarter share, and they are rolling out prevention projects across care homes and people's own private homes in order to keep them at home longer and safer, and hopefully reduce care packages or prevent the early admissions to residential and nursing homes. So you'll see on the slides here, you'll see the breakdown of funding. One of the things I'd like to point out is that those of you that are familiar with the hospital discharge grant, which was set in train during COVID, this is continuing. We're happy to confirm, but it is being consolidated into the BCF grant. This gives us a bit more flexibility because it takes away the criteria that was put in place during COVID. So we can use, for example, the Dementia Intensive Support Programme, which was actually instigated last year, as a discharge-only programme support to people diagnosed with dementia. This can now be expanded into the community because the criteria around discharge funding has actually been removed. So the funding isn't significantly different to last year's figures, but we have managed to balance the budget going into 25-26. So you'll notice that the hospital discharge grant is split into 2 now. It's split across the local authority grant, which used to be called the IBCF and is now renamed. And it's also split across the Better Care Fund. So IBCF, or local authority grant as it is now called, has been allocated into totality into adult social care again, along with the consolidated discharge fund. So the new scheme slide, you will see on this slide, the new scheme, this is digital and adult social care. It gives you an idea of some of the programs that are being supported by the new team. We have the razor chairs, which some of you will be familiar with, which is to enable people to be lifted from a fall without admission into hospital, and that's rolled out across various care homes, domiciliary care, and also ambulance services. There's also a new programme, which is the pain check for residents who have found it difficult to communicate. There's an app which can actually, through facial expressions, that can actually identify whether a resident is in pain or not, and the clinician can then follow through on the information that they've received. There's also another new project, which is RoboPets. This is around social isolation. These are robotic pets which do make noises. They do purr, a cat will purr, and they are, you stroke them, you will feel the vibration, and these are being rolled out across care homes, and also domiciliary care workers are taking them in on visits as well. The other projects have been running for a little while and are in train and continue into 25-26. So that is the new change scheme for Luton. They have also tried to minimise the amount of metrics that we're supporting going into 25-26. We have 3 core metrics, statutory metrics, which are looking at emergency admissions for people over 65. And this is so that we can identify the work that's required around admission avoidance. Alongside that are 2 supporting indicators, which are not compulsory, but Luton is actually going to go ahead and support. That is unplanned hospital admissions around chronic ambulatory care, sensitive conditions, and admissions due to falls, which has previously been measured in BCF. So we will continue that in 25-26. There is a new metric, which as abbreviation is called DRD. It's a makeup of 2 metrics. So DRD is a discharge ready date. It's when someone is clinically ready to be discharged from the acute and is set by the consultants in the hospital. That is the date where it's not a projected date, it is a fixed date when they're actually ready to be discharged. And on top of that, we are looking at those who aren't discharged on their discharge ready date and looking at the number of days that they are delayed from that point. And you will notice that in the actual plan, we have a slight data issue with this particular metric, which we need to review and we need to build on. It's not a performance issue. The performance in the LND is actually very good, and across Bedford Hospital Trust as a whole, it is purely a data collation issue, which we are working to resolve. So in the interim, we've set a reasonably low target for this particular metric, that's 70%, but this will be reviewed on a monthly basis as we become confident in the data that's actually flowing through to us. The third metric for this year is actually admissions to long-term residential care homes and nursing homes, which is a standard BCF metric, and that continues into 25-26. There are metrics, again, supporting metrics on the far right-hand side, both for the discharge delays and also the discharge into the usual place of residence, which Luton is going to voluntarily report against as well. And on this slide, I won't read through it, but these are the targets that we've actually set for 25-26. Just for simplicity, although the hospital discharge has actually been merged into BCF this year, we have, for members' understanding, actually set it out in a slide as to what we are investing in. You'll notice that this is a repeat of everything that we invested in last year. Halfway down the slide, you'll see the dementia intensive support service. This is the one that we can now flex to take referrals from the community. And this business case is being written up as we speak. And is waiting for approval from the Joint Strategic Commissioning Board. You'll also notice that on halfway down the slide again is the delirium contract, which is going through a re-procurement. The third document that you'll have in your pack is actually the intermediate care capacity and demand exercise. And over the last few years, this has been a voluntary exercise, which Luton has partaken in, and this is now compulsory. We again have projected into 25-26 our capacity and demand figures, and we are saying at this point in time there are no concerns to raise, no risks to raise. If some unexpected circumstances arise and demand does exceed capacity, then there are contingency plans in place which are particularly strong in Luton. And I think that's all from me, Chair. It's retrospective, as I say, retrospective approval. We had approval from the designated signatories for the board, and also from the chair. I'm open to any questions that anyone has.
It's the two reports, 10 and 11 together, if people are asking the questions. Yeah. No? Are we happy to retrospectively approve the reports? Yeah? Okay, thank you very much. Thank you. Okay, we now move on to item 12, which is the child-friendly Luton strategy update.
Sorry, Chair, we're doing some handouts just because of the fact
That's
that I
okay.
think the key goals weren't clear in there.
We'll share. Thank you. Yeah, probably easy. Yeah.
Okay, we thought that would make it a bit easier. Okay, thank you. We have come here this evening really just to set out our framework and engagement plan and our strategy in terms of delivering child-friendly town. In terms of obviously this is our framework for delivery against the 2040 objectives. You'll see that there's intersectionality in terms of essentially everything that we do within the council has a direct or indirect impact on our children and young people. And what we've done in terms of demonstrating actually how we'll deliver on this and the engagement that needs to happen in terms of the delivery has looked at the cross section and the cross cutting across all of the directorates within the council, but also the work that we need to do with our wider community in terms of our engagement with our voluntary sector partners, our children, families, and ensuring that actually within the context of all of that, we're listening to the voices of our children and young people, capturing their views and thoughts about actually their aspirations for the town, their aspirations and achievements for themselves in us developing a child-friendly town and the things that they want to see change in Luton in order for that to happen. So we've utilised the programme from UNICEF in terms of rights, respect in school as one of the enablers and one of the drivers for this. So the idea being that actually if we can support our children and young people in developing and understanding their rights within those school places, that then actually has a knock-on effect in terms of actually how they engage and have those respects, the respect and rights for not only themselves but for others, not only within the school but within the wider community as well, and actually using that as one of the things that we want to be able to demonstrate the impact of that within the wider community and see, you know, what happens from that. In terms of the forums, we've set up a delivery a programme of workshops essentially, and actually looking at actually how we're going to engage with the wider community in terms of achieving this, and also our local businesses, voluntary sector partners. We've already done a piece of work just looking at our 2040 objectives in terms of the outcomes that we want to achieve, and actually how child-friendly cross-cuts across all of the directorates within the council. So we've done that with our senior leaders. We're working in collaboration with, obviously you heard earlier on in terms of the Fairness Task Force, and there's some work around child-friendly happening already in that space as well, our family hubs. And so essentially we're using the rights respecting school and the framework that we want to deliver here, looking at actually the framework receiving like bronze, silver, gold essentially, and having an independent panel that we would utilise to provide the scrutiny for us in terms of whether or not we're achieving the outcomes in the way that we want to for our children and young people in the town. At the heart of this is obviously what our children and young people are telling us, and we've had various mechanisms for obtaining their views. So the SHU survey, which has obviously reached in excess of 5,000 children, and then at the end of last year we did our schools conference, which I know that a number of you attended, and clearly you could hear there the passion and the feedback from our young people about actually the things that they want to see and actually feel in terms of the environment within our town as well. So this is about listening to our young people, taking on board what they're telling us about the changes that they want to see happen in the town, and actually being able to have something tangible in terms of actually their experiences of growing, living and growing up in Luton, and actually getting that feedback from them about actually whether or not we're pitching it correctly in terms of the activity that we're undertaking to achieve those outcomes of this being a child-friendly town. The work that we're doing within our Children's Services Department, as I said, family hubs and some of the other departments within the council, all of this is integrated into actually the experience of our children and young people here. So it's making sure that we're utilising that feedback from our families as well, and those forums, neighbourhood forums, to ensure that we're capturing that feedback and utilising that to inform the plans and the delivery for this model. Essentially, what we're asking for is for this to be considered as I said, this is in draft, as a strategy for us going forward, and we will be utilising those workshops and feedback mechanisms to check whether or not the measures that we've devised are correct and tangible in terms of being able to achieve those outcomes successfully. And as I said, using our children and young people as the benchmark for whether or not we've got this right, essentially. So
thank you very much. Thank you for the report. I'm obviously asking members to identify themselves or colleagues,
yes,
to be part of those strategic operation groups or engagement workshops. So I would ask people to, do you want people to get in touch with you, or are you going to be inviting people, or?
Yeah, people can just get in touch with me directly, yes, just to say if they're interested. So we've set out all the key areas as well, that people can align themselves to the key areas in terms of, you know, where they think they can have the best influence and support really in the delivery around this.
We'll make sure people that aren't here this evening get notified as well.
Thank you.
That.
Thank you, Claire.
Are there any questions from anybody? No? Nope.
No.
Everybody okay? Thank you. Thank you very much. Thank you. And we now move on to Mount Vernon Cancer Centre review.
Thank you, Chair. So I'm here on behalf of a number of partners that make up the programme board for the Mount Vernon Cancer Centre review. I've been a couple of times before, and members will recall previous updates about the challenges that we have at the Mount Vernon Cancer Centre, and challenges that really apply to this population in Luton as well, specifically. But also proposals that we have developed with patients and with staff to make the necessary changes. The Luton outcomes work, which you're going to hear about next, has been a real key part of that work for us in helping us identify what some of the additional things that we potentially could do to try and improve access and improve outcomes for Luton residents. Last year, we received permission from the National Strategic Investment Group to go ahead and prepare for public consultation on our proposals. We're in a really unusual position in that we don't have the capital allocation sorted out. And most of the time when you go out to public consultation, you do. I think what they felt was that the arguments for pressing ahead were so significant that we ought to do that. We need to get a mandate for what the changes are going to be so that the clinicians and the patients can have some certainty over the future direction of travel. It was beginning to affect things like decisions on changes that or things that we needed to do, investments that we needed to make in the short term, and where to put those investments, how to go about that. And I think it was just felt that we needed to get on with it. There is only one main proposal on the table, and that is to relocate the service to Watford General Hospital site, where it would be its own self-contained cancer centre run by UCLH, but with access to the acute facilities, in particular A&E and critical care, that is at the Watford General Hospital. There isn't really a viable alternative to that, and without making that change, there is a real risk that services at Mount Vernon won't be able to continue for much longer. As part of that, obviously you're aware we've looked at options to bring other parts of that care closer to home, so to expand the range of chemotherapy that's available in local hospitals, and in some cases provide local chemotherapy in local hospitals where that isn't currently provided. We have expanded a chemotherapy at home pilot. Currently covers 4 breast cancer treatments. We're looking to roll that out further. And we want to build a networked radiotherapy unit in either Luton or Stevenage. We think that either place offers a benefit to the population in the north of the patch. Obviously, you'll have a view as to which would be the preferred location. I'm going to remain neutral. But we've now at the stage where we've put together our pre-consultation business case and various documents, including the Equality Health Impact Assessment, a high-level consultation plan and a draft consultation document. Now, I've linked in the paper to those items. They went to the Joint Health Scrutiny Committee, which has been established across 10 local authorities, including Luton, and I've included the consultation plan in the pack that you've got, because it's really important that we have your input into that plan before it's finalised. It's quite a high-level plan. It's quite a number of pages, but it doesn't go into a huge amount of detail about the what and the when. We are working that out and would really appreciate input from colleagues in this room and colleagues who aren't here today to help us flesh that out in more detail. I make a joke about being impartial about where the network radiotherapy is located. What really matters is that people have a voice, that we hear from people on both sides of that debate, people with ideas on both sides. And so I'm really passionate about making sure that people in Luton have the opportunity to give us their feedback, give us their views, and stake their claim, as it were. We're planning public consultation later this summer. We are currently in the assurance process, so we've submitted all the draft documentation for the assurance team to review and provide feedback. And along with scrutiny's feedback and your feedback and other people's, we'll develop a final version that will go to a panel. That date I don't think has been confirmed yet, but we're hoping that will be next month. And then we will go ahead, assuming that we pass the assurance tests, we will go to a national committee where they will decide whether we can go out to public consultation. And as soon as we've heard back from that committee and it's a green light, the only thing stopping us is how long it takes to print the documents. So we are planning and optimistic that we will be consulting this summer. I think that's really all I needed to say. I won't take up any more of your time explaining the background. I think you're well familiar with that. Happy to answer any questions on the proposals, a case for change, or the consultation plan, which obviously you have.
If we can help with the consultation plan, I'm sure we would be more than welcome to make sure that our community get access to the consultation. And if we can help with our diverse community in particular, please do let us know.
Yes, thank you. We've got some good links in through the ICB and also directly into the council. We're well linked in with the cancer community champions. I went to an event in Luton a few weeks ago that was run by the community champions with the Afro-Caribbean community, and made some new contacts there. So we can always have more, we can always do more. We, at the moment, we don't have a team delivering the consultation, which is, I think, one of our biggest anxieties in terms of how we deliver the kind of engagement that we want to do. And so the support of local communities in helping us reach people will be really, really critical.
To say on this, yeah. Okay, are there any questions? No questions from anybody? Oh yes, from the back. Yeah.
I just wanted to ask, so you said about Stevenage or L&D could be either. Is that part of the consultation? Because that's really quite important.
No, it's important.
People in Luton about cancer outcomes.
Yes, particularly looking at paragraph 15 and our equity levels of it. It's really important our community have a say on where they think this should be. Yeah.
Yes, so the main proposal is to relocate to Watford. There is only one option for the main proposal, and the consultation is based on finding out and understanding what the impact of that will be and how we can mitigate any negative impacts or how we could make it even better. But within that, then there are 3 variations of that. One is everything at Watford, one is everything at Watford with a network radiotherapy in Stevenage, and one is everything at Watford with a network radiotherapy unit at L&D. And I think Stevenage has long been, for many, many years, campaigning for a satellite radiotherapy unit. They've had their previous MPs were on the case. I think I can go back 15 years in Hansard to find questions about it. But once we saw the inequalities data around Luton, it was a bit of a no-brainer really to start considering actually, is Stevenage the only place we could put it, or are there other options? And Luton obviously being one of those, and Bedfordshire Hospitals kindly worked up a proposal, have said, yes, there's the capacity on the site. I'm sure you can speak for that more clearly, but we have a workable solution for either site. We don't have the numbers of patients that would justify having both. And we have one area in the southeast where they'd quite like a unit, and they don't have the numbers of patients either.
Oh well, I think the consultation becomes even more important then. So whatever we can do to help with that, definitely. Yeah.
A couple of points building on what we're saying. And first, just you referenced the EQIA. I wondered the timing of that and how much that might inform the outcomes of that, informing the consultation. The other point is actually just on the consultation itself. We understand the pressures and the choices really. I think there's a real challenge to make the consultation meaningful and in a clear way that people can understand what their options are. It's just not pages and pages of stuff, and actually some of that's sort of complete anyway. These are the choices, as you just quite rightly said, then those 3 options, what people are really looking at and considering. And then the final point for me is the numbers and the flow. From what we've got at the moment to what we're going to have in the future, what's the patient flow, pressure, impacts of that as well, and how would that play its way through in the consultation?
Yeah, thank you. So in terms of the patient flow, the modelling that we've done, so we originally built our consultation plans around data when we started this review. We have since updated it. Luton are sort of middle-sized in terms of areas that send patients to Mount Vernon, and we have factored in growth, we have factored in demographics and looked at what that projected usage would be over however many years. For radiotherapy, there are actually, according to the mapping software that we've used, more patients who live closer to what would be a Luton unit as opposed to a Watford than do live closer to what would be a Stevenage unit than Watford. So if you were doing it on numbers alone, you could start to make an argument. We've also, in the criteria for radiotherapy, we have included quite a lot of weighting around inequalities for how we make the decision around network radiotherapy. So there are some heavy weighting numbers towards access and towards inequalities, reducing inequalities. And there are a number of measures. Stevenage, that area has a larger older population, and we know that cancer is more prevalent in older people. It's a more rural area. We know there's some challenges there. But in L&D, we have the situation where we know that outcomes are poorer in this area. We know that there is a more diverse community, and ill health is more prevalent. So it's going to be an interesting. We've been quite careful not to do the scoring or anything now. We need to make sure that we've got the criteria right. One of the questions that we've proposed for the consultation itself asks some questions to help identify what patients think is the most important thing that we should be thinking about when making the decision, assuming all of the clinical boxes are ticked.
Okay, thank you. Anybody else? Any other questions?
Yeah. Just on the same, would it be possible to see any of the modelling?
Yeah, absolutely. I can send that across to you.
Brilliant.
Okay. Thank you very much. Oh, yeah, sorry.
Just to say that Elizabeth and I are quite new to our posts, but we're very willing to work with you in the what is fairly short term before you do your consultation. So yeah,
excellent. Thank you.
Yes.
So, having been involved with the community connectors and getting that off the ground, and being involved with the outcomes group for cancer right at its start, one of the biggest things for Luton was people will not travel to get that treatment. So, you know, they're not going to suddenly travel to Stevenage. So we need to really be behind this and have some really good data on it for Luton.
Okay. Any other questions from anybody? No? Okay, happy to approve the report, and obviously we'll keep people updated on the consultation as it comes out. Yeah. Thank you. We now move on to I think last report, is it? Yeah. The cancer outcomes, item 14.
Thank you. So I'm here today to present an update on the Cancer Outcomes project that's been running in Luton. So as many of you will know, the project has been running since 2021 to address long-standing concerns about cancer mortality rates, uptake of treatment, referral rates, and stage of diagnosis. The original project steering group reviewed population and outcome data to identify underlying drivers behind poor outcomes and produced a list of short, medium, and long-term recommendations. These recommendations have been streamed into 4 focus areas, which are screening and early diagnosis, diagnosis, treatments, and access to healthcare, prevention and wider determinants of health, and community engagement. Since presenting to the board a year ago, the group has made quite good progress with the recommendations. We have circulated a full report with the papers, but there are some key achievements to highlight. This is our targeted lung health checks project has been fully rolled out across Luton. This is in recognition of the data which suggests that Luton has much poorer outcomes with lung cancers and has one of the worst or the poorest survival rates. As a result of the project, which offers patients that meet eligibility criteria a low-dose CT, we have successfully diagnosed 33 cancers as a result of the scans, and 26 of these were at stage 1 and stage 2, which is really good news for Luton residents. The next stages of that project are to continue rolling out scans to new patients that meet the eligibility criteria. We have also completed a prostate cancer case finding pilot. This was as a result of COVID and recognition that there was quite a gap in the number of normal diagnosis rates we would see and to the diagnoses that were made during the COVID period. We did the prostate cancer PSA tests for 736 patients. These were high-risk patients, black men, I believe, over 45 with a family history, and diagnosed 36 cancers, all of which are now undergoing treatment. We have an evaluation report which has been completed and is going through our cancer board next Thursday of this week. But we are already using the learning from that project with PCNs and looking at how we engage with residents and how we encourage people to come forward for screening, and also to look at how we can do other case finding pilots in the future. So looking at where we know we have cancers with high late stage diagnoses and poor outcomes. We are in the final stages of implementing a project to deliver blood tests closer to home for Luton residents. This is primarily patients that are attending Mount Vernon Cancer Centre, and as part of their schedule of appointments need to have blood tests. They have previously been attending Mount Vernon for those, so additional travel time, and we will be able to provide that at the Luton and Dunstable Hospital through the phlebotomy services, which will reduce significantly the travel expectation for residents. We also have a Luton transport project now operational. The team have provided over 100 journeys for Luton residents to the L&D, to Mount Vernon, and also to Stanmore. We've had some really positive feedback. So the next steps there are to continue publicising the service and also monitoring the feedback received to see how we can develop the service more. We've also recently started a health needs assessment with the public health team. This will track the improvements made since the project started and help us identify the next set of recommendations to take forwards. And as we've heard about our community connectors, we continue to work with them and support their engagement with local communities. They have hosted and attended a number of events over the year, and most recently looking at faith and cancer. So the plan for 25-26 is to, as I say, really identify the next set of recommendations to take forward. We want to look with the public health teams at how we can secure the sustainability of the community connector programme so that we can keep engaging with local residents, and also continuing to implement a behavioural science project. This has recently started in Luton. Phase 1 was with primary care, looking at how we can encourage residents to uptake cervical screening programmes, working with PCNs to look at the engagement that they send out, such as their letters and texts. We've had some really good results from that. It's only gone live in the past 3 weeks, but so far it's shown quite good results. And the next phase of that is to look at compliance with the pathway in secondary care and how we can support residents to attend appointments, encourage people to have hysteroscopies and diagnostic tests that need to be completed. That's everything I wanted to bring up today, but I'm more than happy to answer any questions that anybody may have.
Thank you. Any questions from anybody? Umi.
Thank you. That was a really good report. It's very thorough when I was reading through it. I just had a question, which is probably going to sound a bit bizarre, but how much has this, have you looked into the effects on paediatric cancers? Now, I know that they're very rare, and I know the prevention aspect is not something that's going to be significant impact on that, but particularly around the early stage diagnosis, people in Luton, most treatment is done over at Addenbrooke, access to getting to treatment over there. And yeah, just want to know a bit more about that.
Yeah, happy. So the paediatric cancers, as you rightly picked up, are diagnosed primarily and treated at Addenbrooke. So they don't tend to touch our pathways, and we don't necessarily see the outcomes as such. So the focus has very much been on adult cancers. However, it's not something that I think we would rule out looking at in the future or within the next phase of the project, because children's and young people's experience of cancer is obviously significantly important.
So it hasn't been looked into at all?
Not in the first phases of the project, no.
Okay. Anybody else? Yes.
There's lots of myths in Luton in certain communities, like the traveller community, about cervical cancer, and that they've only had one partner, so they don't need screening. So is there any sort of health education for people around the benefits of screening?
So I think that's one of the things that we're looking at in the behavioural science project. So it looks at specific communities within Luton and the barriers for them accessing screening. And as I say, the project that we're running at the moment has got some really good links in with communities. It understands what appeals to them and the messaging, and it's really targeted towards them. So the pilot at the moment is on a specific Asian group of the community, but we would definitely be looking at that in the next sort of phases to see how we can support other groups to come forward.
Yeah. Cool.
I was involved number one, in starting, and number two, took part in the targeted lung health check, which was, seems like years ago now, and I think it probably was. I did the CT scan, and then I got called back for 2 years later to do the follow-up. And now, I think last week, I've had a call back 3 years later to do it. I'm just wondering, because we were concerned at how many people would drop out and how many people can. Do we have numbers on how many people continue to have those calls and have the CT scans, and how many drop out essentially?
They will be held by the team themselves, the lung screening team. I don't have them to hand, but I'm more than happy to provide an update to the board afterwards.
Okay, thank you. All right, Phil, thank you. Anybody else? Yes.
Just on the number part, because the latest data is 2018, and the assumptions are then what based on 7 years ago. How if we got any gauge of whether that's on track or not, or
We do. So we're currently looking at a suite of dashboards in collaboration with one of our AGEM teams who do all of our data analysis for us. And we have refreshed that data, and it will be fed into the health needs assessment that we're working on also.
that'll come back to just sort of reconsider, assume the figures are correct.
Yes, we'll be able to bring it back and update.
Brilliant. Just a second question, just with regards to the success you've got here that's come through to varying degrees, is there any opportunity for further investment in the context of other facilities changing or being reduced?
I think at the moment in the cancer programme, that's not really been bottomed out. I think we've, with access to funding and things being the way it is, it's something that we'd look to work forward in the next step. Within the next steps.
If we could, I think that's in context of the previous paper we've just had, that would be helpful.
I'll just say that's worth picking up with Sarah Stanley and that inequalities. Is it that?
Well,
yeah. So rather, sometimes it can get lost in the cancer board rather than.
Yeah.
About it. Yeah.
Thank you.
Can we note that as well?
Do you want to say? Yeah.
I just wanted to ask, while we're talking about lung cancer and lung health checks, making sure that we're up to date with the research that's come from the CHILL study. So you'll probably be aware the CHILL study was a 5-year study with our children in primary schools in Luton looking at their lung health compared to London. Okay, and I think there's probably some nice findings and data that might give us some indications of how we can improve lung health locally. So yeah, right. Okay. So it's Gertch from the university that you need to contact.
Thank you. That's really helpful. I'll make sure they're fed back into the
Thank you. Anybody else? Phil.
When James came and reported, I think a year ago possibly, he told us the number of deaths as a result or with cancer, and that had reduced quite significantly. I seem to remember him saying when he was here, in fact, I definitely remember him saying when he was here, and I'm just wondering if it's reducing any further now or not.
I don't have that data with me, but again, that's something I can pick up from the dashboards that we've got and bring back to the group.
Yeah, because it was quite significant. I seem to remember the last when he was here, and it was a big success, I think.
Information, can you? I think. Thank you. Great, thank you. Anybody else? Okay. Well, thank you very much for the report. Thank you. We look forward to seeing things happen. The last report, I believe, is a procedural report for the council, I'm afraid, just to go through our AGM procedure. So it's not any major changes or anything. It's just asking you to accept what's going to go through our council. I apologise for it, but if anybody's got any queries, we have to do all this sort of paperwork stuff as a council, I'm afraid. So if anybody's got any queries, please don't hesitate. But other than that, I would ask you to support the recommendations that are there, if that's okay. Thank you very much for your tolerance this evening, for listening to quite detailed information. It's all been very, very important tonight, I think. So thank you very much for the presenters and for all the work that's gone into the reports, etc. It's really appreciated.